Do you need to say anything?
Yeah, don't worry, Janetta. I'll introduce you. This is Janetta, who is our head dental nurse. My name's Glaf Kostombolis. I'm the owner of Ethicare Dental. We're going to be making a series of videos. So apologies if we're a little bit nervous in terms of making these videos, but we wanted to do more of an informal thing so that patients have a little bit of an understanding of what goes on behind the scenes at a dental practice. So we're just going to take you through a scenario. So we've just finished a treatment or an examination. We've finished with some instruments and they're dirty, obviously. So what do we have to go through in order to get them clean for the next patient? So Janetta, what would we do? Let's say we have the instruments sitting on the treatment table, and then what would we do with those instruments first of all in the surgery?
Yeah, so we have to take them to the sterilization room.
So we take them to the sterilization room, but you're holding a box there.
Yeah.
So are the dirty instruments in there?
Yeah, dirty instruments.
So these are the hypothetical dirty instruments. I'll tell you now that they're actually not dirty, but we're going to kind of guide you through what we'd be doing. So these days you have to keep the dirty instruments in a box.
In a box, yes.
Right. I think that's because so that you don't drop them, and
yes.
keep a lid on them so that if you run into somebody in the corridor on the way there, things don't go flying, and so on. So right, we're going to follow Janetta as we go here. Okay, we'll back out of the way here. Okay. All right, and then we'll follow Janetta as she goes to the decontamination room. So you can see she's wearing her gloves. Now, the decontamination procedure takes quite a long time because you have to disinfect them first, and then you have to put them through a sterilizer, and that all takes about 45 minutes or so. So you can see what Janetta is doing. She's putting a little something, just an apron, just to protect her.
That's broken, by the way.
That's broken. These things happen on live TV. No worry.
Let's get another one.
So she puts her apron on just to get her covered. She's got her gloves on. I don't know, there's a few ways of disinfecting instruments, aren't there?
It is. So, in this case, we will pop our instruments into ultrasonic bath.
Yeah.
And keep it for 6 minutes, and afterwards we will rinse and inspect.
So you put the instruments in this sink here, and then so after putting them in the ultrasonic bath for 6 minutes or so, you then put them in the sink, right?
Oh, so no, because they're already in the solution. So there is some solution, so they already soaked.
They would be in solution.
Yeah.
Imagine there's some solution in there, and then the instruments we put in that solution, and they'll be soaked.
Yeah.
So we're putting these in the ultrasonic bath, but we're not going to wait 6 minutes because that would not make good live TV, right?
No.
Right. Okay.
So just imagine 6 minutes.
Oh, just switch it on. It makes that funny noise. 6 more minutes, and then what happens?
And then we have to remove them.
Yeah.
Place them into another box.
Into another box. Okay.
Another
wow.
box.
Okay.
With the water.
Okay. So we've got
Just
water in there.
full.
Imagine water. We should have prepared a little bit better.
Yeah.
But the water imagine the water was in there already.
Yeah.
Anyway, the water is now in there.
Yeah,
and then what happens? You get the instruments.
We'll rinse them.
And then rinse them in there. Yeah. Yeah.
And then once that's done, then we have to inspect them.
Yeah.
To make sure.
You inspect them under a magnifying glass in order to make sure that there's no debris on there.
No debris. No. Yeah. That's correct.
All right. Okay.
Once that's done, then we will.
But that's the purpose of the ultrasonic bath and cleaning them manually, so that you can get rid of those bits and pieces. But the magnifying glass is just to check.
Yeah. So we can do manually, or this is just an extra bit.
Okay.
If there is anything on there, so we can use brush.
Yeah.
Long handle brush to make sure we won't injure it ourselves, so we need a long handle with brush.
Long handle, yeah.
Yeah, and then when that's all done and inspected.
Does it have to be like of a certain temperature in there?
Oh yeah, so below 45. At the moment it's 29.
Yeah.
But as long as it's not more than 45, it's absolutely fine.
Okay.
It's very important that we use our face mask.
Face mask? Yeah. Okay.
And our visor.
And visor.
Just to protect our eyes.
Okay, yeah.
So that's very important.
You never know what could splash up.
And plus, heavy dirty gloves.
You've got heavy duty gloves here.
Gloves.
Yeah.
Very thick gloves.
Okay.
Because this one might be too thin and we might, you know.
Yeah.
Injure it up. So.
Yeah.
Yeah.
So once you look under the magnifying glass and they're ready. At that point, they need the instruments are clean, but they're not sterilized.
Yeah.
So you have to put them in a sterilizer.
And you have to put it into the sterilizer.
And the sterilizer kills all known germs, right?
Kills everything.
It kills everything.
Kills everything.
In there, okay. And
Kills everything,
and we've got 2 autoclaves here at the practice. One which is used 95% of the time, and the other one which is used when this one breaks down or something like that. Our backup.
So yeah. So
how long does it take to do a cycle?
So it takes. We can see here. So
when we sterilize.
So when we sterilize, when we put the button, when we press the button to start, it says everything. So for example, the last cycle started at 2:40 and finished at 2:59.
Okay, all right.
So just almost half an hour.
Almost half an hour.
And
thankfully that looks as if it's passed. Okay, so that's good news. And those receipts are kept in a book, but also we have the information stored on a USB stick, and that is stored in our computer as well.
The pressure, the temperature, everything is here.
All that kind of stuff.
Very safe.
So let's say, okay, by the way, you have to pouch the instruments, don't you?
And afterwards we have to date. So this is our little stand.
So the instruments go in a pouch before they go in the autoclave, yes?
Afterwards.
After they go in the autoclave. Thank you, Janetta, for correcting me.
The surgical ones.
The surgical ones go. They go before.
We do twice. We sterilize, we remove, we pouched, and we.
Okay, right.
Autoclave again.
Perfect. And then you stamp the instruments. Why do you stamp the instruments? Sorry, the pouches, not the instruments.
Oh.
You pouch you stamp the pouches.
Then we know when we're done because it's valid only for 1 year.
That's right. So the instruments are valid for only 1 year.
Yeah.
Okay. So if anybody looks at this video in about a year's time, they may change the regulations. So this is valid from the beginning of 2018. Okay.
Yeah. So this is our pouches.
Okay, so those are the pouches, and the instruments go in there, and then those are dated. And then what happens to those pouches and those instruments? Where do they go then?
So then we'll pouch them, and they're going back to. I have to bring them back to the surgery. And
then they go back to the surgery, and they go in the drawers, ready for the next patient. All lovely and clean. Janetta, thank you very much for that. I hope this is of interest to our patients. Thank you very much.